The Colorado Department of Public Health and Environment launched a new statewide campaign to raise awareness about Alzheimer's and other dementias among Coloradans. Joining us now is Joanna Espinoza-Robbins, who is a program manager for Alzheimer's disease and related dementias. Thank you so much for joining us on this very important topic. We appreciate it. So how is this new Talk About Dementia campaign different from previous campaigns?
So, Brian, this is the first time we have done a public awareness campaign about dementia. The goal of this campaign is to get people talking about their brain health and normalize conversations about dementia. We wanted to be able to reach as many Coloradans as possible, which is why you'll see this campaign was launched in English and in Spanish.
It's important because I think all of us, many of us, are affected by either Alzheimer's or dementia. Kind of peeling back a little bit, what is the difference between Alzheimer's and dementia?
So dementia is an umbrella term that describes several diseases that can impact memory and thinking ability severely enough to interfere with daily life. You'll often see Alzheimer's disease called out individually because it's the most common cause of dementia. Some of the symptoms of dementia you might notice are things like changes in memory and thinking abilities, changes in mood and behavior and personality, and also things like getting lost in familiar places, for example.
And I think a lot of us think that this is something that happens later on in life when we get older, but it's important to look at the symptoms now, right? And what are those some of those symptoms?
That is true. Age is the #1 risk factor for dementia, and our risk gets higher as we get older. But some forms of dementia can also impact younger adults. One important thing to note is that the changes in our brain that lead to dementia can start up to 20 years before symptoms begin. So this gives us a wide opportunity for risk reduction. Some of the things that keep us healthy in general can also help prevent dementia. Some symptoms that we might see with dementia we talked about before. And early on, some things that people can do to help prevent dementia are things like eating healthy and being physically active. Also things like preventing diabetes, high cholesterol, high blood pressure, and managing if you have it. And even things like wearing a helmet or using hearing aids if you need some.
Yeah. To follow up on that, though, what are some of the signs that we're looking for? Is it just like forgetfulness? Is it hereditary as well? What do we know about that?
Yes, it can be hereditary. We also know that almost half of the risk of dementia can be prevented. And some of the signs I mentioned earlier are things like getting lost in familiar places, forgetting recipes that you normally use, sudden trouble with managing your finances, or forgetting appointments, for example.
And then really quickly, we only have about 30 seconds left. Once you recognize perhaps that you do have the symptoms or that you do have dementia or Alzheimer's, what are some of the next steps here?
It is very important for people to talk to their healthcare providers to get the right diagnosis. Some forms of dementia, such as those that are caused by medication interactions, can actually be reversible. Others, like those caused by Alzheimer's disease, are not. But getting an early diagnosis is very important so people can get the correct treatment and also be able to do things like participate in research or plan for the future. More information can be found on our webpage, talkaboutdementia.org, or hablasobredemencia.org in Spanish.
All right. Well, such an important topic. Thank you so much for being here. We always appreciate it. And you can always watch all of our interviews on our website at cbscolorado.com.